Hey, future nurses, welcome. We're about to tackle 3 conditions that can look incredibly similar in older adults: delirium, dementia, and depression. And let me tell you, getting this right is absolutely crucial, not just for your exams, but for every patient you'll care for.
So here's our game plan. First, we're going to look at why this is such a tough puzzle to solve. Then we'll break down each of the 3 Ds one by one, and I've got some great analogies to help them stick. And finally, we'll pull it all together into a clinical cheat sheet that'll make you feel a whole lot more confident.
All right, first up, let's really set the stage. Why is this whole 3 Ds thing such a classic clinical challenge? I mean, it trips up even experienced nurses, so let's get to the bottom of it. A question like this is a perfect example of how tricky this can be. You see these overlapping symptoms, right? But the real clue, the key, is the timeline. The answer here is B. See, dementia is that slow downhill slide. It's chronic and progressive. Depression, on the other hand, often comes and goes in episodes. The other choices, they're just distractors. Sadness can pop up in both, and meds can help manage symptoms in both conditions too.
So these are our 3 main players right here. And the big flashing neon sign takeaway is that they all mess with cognition. Your patient might seem confused, maybe forgetful, or totally out of it, and it could be any of these 3. That's where you come in. You're the detective who has to sort through the clues and figure out which one you're dealing with.
Let's dive into our first D, delirium. And I'm going to give you an analogy for this one that I promise will help you lock it into your brain for good.
This right here, this is your key. A thunderstorm. It comes out of nowhere, right? It's intense, it's chaotic, it's kind of scary, but it's caused by something specific. And once that cause is fixed, the storm passes. Just hang on to that image.
And this slide spells it out perfectly. The key words you have to burn into your memory are acute change and hours to days. This is the thunder and lightning. It's not some slow drizzle that's been happening for months. It hits fast. And, this is critical, there's always something causing it. An infection, a new medication, an electrolyte imbalance. Something is triggering this storm.
And this is what that chaos looks like at the bedside. The patient's mental state is all over the place, just like the wind and rain in a thunderstorm. One minute, they're drowsy and hard to wake up. The next, they're agitated and pulling at their IVs. Their brain is just scattered. They can't focus. That wild fluctuation, that's the hallmark of delirium.
All right, pop quiz. Let's try a classic NCLEX style question. As soon as you see fast onset and that fluctuating consciousness, what should you be thinking? The thunderstorm, right? Delirium. The answer is A, for sure. A slow onset just doesn't fit the picture of a sudden storm.
Okay, we've made it through the thunderstorm. Now we're going to shift gears completely to our second D, dementia, which has a totally different feel and a totally different timeline.
So if delirium is a thunderstorm, think of dementia as climate change. It is not a sudden weather event. It's a gradual, relentless, and unfortunately irreversible change in the entire landscape of the brain. We're talking months and years, not hours and days.
And look, this isn't just a clever metaphor. Dementia causes real physical changes. The brain literally shrinks. You can see it right here. This is the hard evidence of that slow, progressive climate change taking over.
So let's put them side by side because this contrast is everything. Onset is probably the single biggest clue you have. Are you dealing with a sudden weather event, or are you looking at a long-term change in the whole climate? If you can answer that one question, you are way ahead of the game.
And finally, let's get to our third D. This one can be the trickiest of all because it's a true master of disguise. Let's talk about depression.
Our last analogy for today is a persistent fog. You know that feeling when a thick fog rolls in? Everything gets hazy, unclear. It slows you down, and it's just hard to see what's really going on. Well, that is exactly what depression can do to a person's cognition, and it often makes it look an awful lot like dementia.
And this number right here, this should really get your attention. In the population you'll be working with most, especially those over 85, the rate of depression literally doubles. That means you have to be on high alert for this. It's incredibly common.
Okay, this is absolutely critical for you to remember. In an older adult, that fog of depression often doesn't show up as sadness. Instead, it looks like fatigue, weakness, or just some vague aches and pains. The patient might just say, "I just don't have any energy," which is so easily mistaken for something else.
All right, let's pull all these pieces together. We've met the individual players, so now let's put them side by side and build your ultimate guide for cracking the case of the 3 Ds.
First things first, let's lock in these core analogies one more time. Delirium is the sudden thunderstorm. Dementia is the slow climate change. And depression, that's the persistent fog that clouds everything. Seriously, if you remember nothing else, remember these images. They're your mental shortcut.
And here it is. This is your clinical cheat sheet. You can use this at the bedside. Just look down the rows. Onset, is it acute or insidious? Course, is it fluctuating all day or slowly getting worse over time? And look at attention and consciousness. They are most disturbed in that thunderstorm of delirium. Go ahead, screenshot this, memorize it, and use it. So what do you actually do when a patient shows up with cognitive changes? You don't guess, you assess. You have to put on that detective hat. Remember, delirium, that thunderstorm, always has an underlying cause, and your job is to find it. That means a full workup, history, physical, labs. You have to rule out things like infections or drug side effects.
So I want to leave you with this question to take with you into your practice. Now that you can spot the thunderstorm, the climate change, and the fog, which one do you think it's missed the most on a busy hospital floor? And more importantly, what's one thing you're going to do to make sure you don't miss it? Your sharp assessment skills are what will protect your patients. Thanks for joining me.